a soldier jumps on top of a grenade to protect his comrades, you're looking at one of the greatest human behaviors on earth, is the love for somebody else to protect them. But when we talk about veteran suicide, it gets very complex. About 98% of people have a revulsion to killing another human. And unless it's for a self-defense reason, which is how we could justify it, but the act of killing another human is very emotionally traumatic. It creates a burden that if we're not equipped to reconcile. There's a very small group of people, an elite group, I call those people the warriors. They're able to reconcile some of the things that have to be done with living a normal life, and they're able to continue to function properly. But the act of war is very traumatic for a majority of people that are there, and the hard part is they go from being a civilian and then 6 months later they're on the battlefield. Here's why we have a problem today. When you read about the history of war and the act of killing, you'll find out that through history of a majority of soldiers, they would avoid killing an enemy almost at all costs, sometimes to the detriment of themselves. They'd have an aversion to killing. And so what happened was the military started to implement techniques designed to raise what we call the shoot-to-kill rate. It was about 50% in the Korean War. They got it up to about 90% in Iraq and Afghanistan, and this is training someone to be able to shoot and engage with the enemy. And when you study how this training starts, one of my Marine friends that did the Battle of Fallujah in 2004 said every time he threw a punch that they'd yell "kill" at the top of their lungs. They'd scream the word "kill" as they threw a punch. So you're training someone to be a warrior. By implementing this type of training, what we've done is we've raised that shoot-to-kill rate to 90%. Unfortunately with that, what we've done is we've caused a whole array of psychological issues as these people come back that now have to process and reconcile this. And in the modern era, what we call that is the post-traumatic stress. The problem really lies that deep within our hearts, what we truly seek is love for ourselves and also to be able to love other people. And it becomes extremely difficult to love yourself if you're carrying around the guilt. When we get into veteran suicide, we get into a very complex issue. Veteran suicide rate currently, based on the VA's published statistics, is about 22 people per day, which roughly comes out to about 1 per hour. And it's a very sobering statistic that this many veterans get to that point in their lives, with that darkness, where they feel they need to take their lives. So as we examine what's going on, we'll talk about the emotional trauma in this shoot-to-kill rate, now up to 90%, and trying to reconcile this. What happens when a soldier comes back is a couple of different issues occur. One of the main issues is the loss of the brotherhood, which is that feeling that someone's going to take care of you and be there in the event that you have an issue. And that bond that's formed on the battlefield when somebody's trying to kill you, and you know that somebody is willing to risk their lives to save you, or as I started out, in an event, jump on a grenade to save your life. That creates a bond that very few people on this earth ever feel. But you compound that loss of the brotherhood with the guilt that a lot of people feel of actually having to take a human life, and you start to see this emotional thing spiraling out of control. One of the questions that I hear a lot in the veteran community is, how could somebody be so strong to be in battle overseas and lose the battle here at home? And part of what happens, and I see this quite a bit, is there's this false expectation that somebody puts in their head about how they're supposed to be or who they're supposed to be, and they're not able to live up to that expectation. And that creates a lot of guilt and a lot of pain. And you couple that with some people that have enormous physical pain from wounds and injuries, and you start to get a recipe that creates a very dangerous spiral. And when we talk about suicide, suicide is not a knee-jerk process. It's not a knee-jerk decision. Suicide is a lot of negative self-talk. Somebody has rehearsed it in their head numerous times before they ever try to overdose on pills or put a pistol to their head. They've had this conversation many times that their life would be better off if they weren't here, or even the people around them would be better off. The hard part with suicide is it's a permanent decision to a temporary problem. And that creates a big issue, because if we're here to love, to be loved, that obviously is no longer a possibility when somebody leaves. One of the ways we talk about that is you literally transfer your pain, and now you give it to somebody that loved you, which is it's a really hard thing to do. I think a lot of people, if they could see the psychological pain that it caused on their friends and families when they make that final decision, they wouldn't, but they don't see that. And so when you get into this state of isolation and depression, and oftentimes we've got a lot of substance abuse here, and the substance abuse is there to try to fill the issue with the guilt, and then also sometimes to cover up the problems with the expectations and people feeling that they're not living up to those expectations. So as we get further into this, resolving these emotional issues, we go back by the decades, and we talk about, this is a model that I teach, and we talk about all the different issues that people have struggled with in the different decades of life, and we try to balance out the emotional component, because what we find is a lot of people that struggle with the post-traumatic stress and the suicidal tendencies have some real rough things from their childhood. And so if those issues are never resolved, and then you are subjected to the battlefield, and then you have more psychological issues, or should I say the most extreme psychological issue you could deal with, it becomes very confusing. And a lot of people get very isolated, very scared, and then it becomes easier to make that final decision to take your life. If you found this video helpful, or you think this could be helpful for someone else, please ask you to pass along this information. One resource you could utilize if you are a vet that's struggling, or you know someone that's struggling, or a friend, is a program called Movement 22, and they've got an Instagram page and a website. The website is movement22.com. The Instagram page is 22 Too Many. These are resources for veterans who find themselves in a dark place, and it's a way to get veterans connected with other people and find some of that brotherhood that may have been lost, and begin to get the help and get on the road to recovery. If you're interested in getting started on the road to recovery, and you'd like to find out more about the seminars, the workshops, and the classes I teach, you can find out more at drwegmann.com.